Welcome to Health Talk. Today we will be discussing peripheral vascular disease, chronic limb ischemia, and the Limb Salvage Program at Pikeville Medical Center. But first, let's get to know our doctor.
My name is Hunter Boschel. I'm an interventional radiologist. I started working here at Pikeville Medical in May of 2012. I did my medical school at Marshall University in Huntington, West Virginia, residency and fellowship at University of Cincinnati. I did my residency in diagnostic radiology, fellowship in interventional radiology, and I've been working in the Ashland and Huntington area since I graduated from residency in 2010, before I came to Pikeville Medical Center.
What's all the talk about peripheral vascular disease?
Peripheral vascular disease is a very common disease, but not all that well known. It's what it is basically a narrowing of the arteries that feed the legs and the feet. It's very similar to heart disease, which there's a lot more common knowledge about. Typically the same risk factors as you have for cardiac disease, including smoking, diabetes, high cholesterol, high blood pressure. So common disease affecting about 8 to 12 million Americans, particularly those that are over 50 years of age. Over 2 million Americans are currently experiencing what we call chronic limb ischemia, and up to 3 million have diabetic foot ulcers, which are also a part of the peripheral vascular disease spectrum.
I've heard a new term, chronic limb ischemia. What is that?
Chronic limb ischemia, or what's commonly known as CLI, is a manifestation of peripheral vascular disease. You can have peripheral vascular disease or narrowing in the arteries without having symptoms. Typically this is because you still have adequate blood flow to the legs. Limb ischemia technically means decreased blood flow or decreased oxygenation via the blood flow to the legs.
Who is affected by CLI?
Peripheral vascular disease and then associated chronic limb ischemia, or CLI, affects a large portion of our patient population. People that are most at risk are diabetics and smokers, people that have other risk factors for general vascular disease, including high blood pressure, high cholesterol, particularly those with a personal history of vascular disease, being cardiac disease, if you've had a heart attack, if you've had a stroke, if you've got strong family history and other risk factors.
Who should be tested for chronic limb ischemia?
People who should be tested for chronic limb ischemia and peripheral vascular disease include people who have those risk factors. If you've had a stroke, if you've had a heart attack, if you do smoke, if you do have high blood pressure and high cholesterol, particularly if you're over 50 years of age.
What are the signs and symptoms?
Peripheral vascular disease and chronic limb ischemia present typically as pain in the legs. Frequently this will start off as pain or a cramping sensation when walking, and this can progress to pain at rest or pain when not walking. If left untreated, this can then progress beyond just pain to tissue breakdown, ulceration on the feet, and ultimately amputations.
How do you test for CLI?
There are a few different ways to test for chronic limb ischemia. The typical screening test is what's called an ankle brachial index, or an ABI. This is a very simple test that can be performed in a physician's office. Basically, it consists of taking the blood pressure in the arm and in the leg and seeing if there's differences between the blood pressure in the arm and the leg. If the ABIs are positive, or if there's you're a high-risk patient, or there's a high suspicion that you do have peripheral vascular disease, we can do a test called angiography. There are two different types of angiography. Angiography basically means pictures of the blood vessels. We can do this either with a CAT scan or with catheter-directed angiography, which is somewhat similar to having a heart cath, where we puncture the artery and directly inject dye and take x-rays. These are outpatient tests typically. If you do have an intervention while having the angiography, you may spend the night, but very simple tests.
Does the treatment of CLI prevent amputations?
A treatment of chronic limb ischemia, so basically it's important to understand exactly, we've talked a little about chronic limb ischemia, but what that means again is that we have decreased blood flow to the leg, and that's what eventually leads to pain and then ulceration and tissue breakdown. Without adequate blood flow to the end organ, which is typically begins with the foot, there's not going to be any healing of these ulcerations and wounds. Without healing, you're set up for infection, and then infection can progress to diffuse sepsis and systemic illness. So the treatment aim is to increase blood flow to the leg, and there's a few ways that that's done. In the past, there were open surgical options, which are still viable. However, there's a number of endovascular, which means minimally invasive or minimally intrusive procedures that we do, a lot of wire and catheter-based procedures to increase blood flow, what we call inline blood flow from the aorta, which is the large artery which comes out of the heart and into the abdomen, to directly inline flow to the foot.
Help me understand the severity of the situation.
So we've talked about some numbers and some of the clinical aspect of chronic limb ischemia, but the question is why be worried about, why treat it? Chronic limb ischemia can have devastating clinical consequences. A lot of people don't seek treatment because they think that the aching and pains and things of that nature are part of normal aging. The numbers are pretty sobering, though. 25% of people that have the onset of chronic limb ischemia will be dead within 1 year. Another 25% will have an amputation within a year. And of those 25% who have amputations, 40% of those patients will be dead within 2 years. The treatment and more specifically prevention of chronic limb ischemia is just of paramount importance.
How does the Limb Salvage Program work at Pikeville Medical Center?
So at Pikeville Medical Center, currently we do have a Limb Salvage Program in place, and the aim of that is basically to prevent amputations and the associated problems that come along with that. What that includes is we're trying to make a more concerted effort to screen for peripheral vascular disease and other types of vascular disease, and we also have new treatment options available. With the arrival of the interventional radiology service here, we're offering some significantly different endovascular treatment options for chronic limb ischemia. Typical things would include angioplasty or ballooning, stenting, and we're doing a lot more work now with the smaller blood vessels below the knee, which in the past were very hard to treat, but we do have some new technology available to help us cross these what we call CTOs, or chronic total occlusions. So far we're having very good results, but the most important thing we can do is get some awareness out there, get people coming in asking their doctors, hey, do you think I could have peripheral vascular disease? Is it something I need to get screened for? And if we can increase awareness and get that screening done, we're going to catch these things before they reach the level of amputation.
How is CLI treated?
So talking about the endovascular techniques, what that basically means, it's a big fancy word, but it means we're going to be inside your blood vessel. And that means instead of doing an open surgery where we cut down to the blood vessel, we simply access a blood vessel, typically in the groin. If we would be working on your right leg, we try to access your left groin and we go up and over into the right leg. Once we're in there, we inject dye to see what the problem is, to see where the narrowings or where the blockages are. And then we have multiple options as far as treating this. If it's simply a narrowing, typically what we will do is use a balloon to open that narrowing, possibly place a stent in there if the narrowing is very severe. If the vessel is completely occluded, again, multiple techniques we use with wires and catheters to get across. And then we have several new devices available that can either help us basically shave away the plaque or essentially drill a hole through the plaque. And once we have a hole, then we go back to the balloons and stents.
Can you help me understand the recovery process?
So actually one of the nice things about the endovascular techniques is they're far less invasive than open surgical techniques. Typically a procedure may last anywhere from an hour to 2 hours. Occasionally they will go longer than that depending on the severity of disease and the difficulty of the lesion. The good thing is though, in most cases, I would say 90% of cases, you're going to be home the next day. Typically this is a single overnight stay. We typically keep you overnight simply to watch for bleeding from the groin where we accessed and any other complications. Keep an eye on you because you have had anesthesia. You're going to be asleep during the procedure. It won't be, not typically speaking, will you be completely out with a tube down your throat like if you're having open surgery. But we do sedate patients pretty heavily, and most patients don't remember a whole lot of what went on in there.
How can I get my questions answered?
So we talked a lot about peripheral vascular disease and specifically chronic limb ischemia and treatment options today. It's easy for me to sit here and talk, but without the opportunity for you to ask questions, I'm sure there's still a fair amount of information out there that some patients would like to have. I would encourage you to talk to your physician, and we're always available at Pikeville Medical Center and the Heart and Vascular Institute to answer any questions that you may have.
Thank you for joining us for Health Talk. If you have questions about peripheral vascular disease and the Limb Salvage Program at Pikeville Medical Center, feel free to contact Dr. Boschel at 218-3500.